Knock knock. Hey Abby,
Hi.
how we doing today?
Good. How are you?
Good. What's bringing you in?
I'm here for a checkup.
All right. So it looks like on today's agenda we're going to be doing a comprehensive head-to-toe assessment. Overall, how have you been feeling recently?
Good. I don't have any complaints.
All right. So we're going to begin today with the skin assessment. Just with inspection here, I see that you appear to be well groomed, of good hygiene. Your skin tone and color is appropriate for ethnicity. I don't note any dirt under the nail beds. Your nails are clean, dry, and intact. I don't see any clubbing noted. I am just going to take a quick measurement here for clubbing, which there is no clubbing noted. Go ahead and do this for me real quick. And there's no clubbing. I'm also going to assess the temperature of your skin, the color, moisture, which it is warm, dry throughout. Skin is smooth. Next, we are going to move on to skin turgor. I'm going to go ahead and assess your skin right here. We're going to look for tenting, which there's no tenting noted. No tenting noted. Next, Abby, I'm going to go ahead and inspect and palpate your hair. Right now I'm looking at the color. It is a kind of like a golden brown. It is well distributed. I am assessing your head here for any ticks or lice, which I do not see any. And as I said, it is well distributed. While I'm standing here, I'm going to palpate your scalp here. Do you have any pain or tenderness?
No.
All right. The shape is appropriate for your skull. Your shape and skull are appropriate for your body size. Next, I just want you to look straight at me. We're going to assess your facial symmetry. Your eyebrows are in alignment. Your eyes are in alignment. Your mouth is symmetrical. Go ahead and smile. Face is completely symmetrical. There's no hyperpigmentation noted. And I don't see any tics or extra facial movements noted. Next, we're going to palpate your frontal and maxillary sinuses. So we're going to do your frontal sinuses. Any pain or tenderness?
No.
Maxillary, any pain or tenderness?
No.
And then your mastoid process. Any pain or tenderness?
No.
All right. And then did you have any pain or tenderness over top of the... No? Excellent. Next, we're going to go to the neck. I'm going to go ahead and have you kind of pull your hair behind your head for a minute. And we're just going to look at your neck. Your neck is symmetrical. There are no masses, webbing, or extra skin folds noted. Go ahead and just give me range of motion here. Excellent. Put your chin to your chest and all the way back. Good. You have good range of motion. Next, we're going to assess your trachea, which it appears to be midline. I am going to stand behind you. I want you to kind of turn towards the camera for them to see. You're going to feel my touch. Trachea moves freely. Go ahead and swallow for me. The hyoid bone moves freely with swallowing. And then one last time here. Your thyroid appears to be, there's no nodules, and I do not feel any enlargement or tenderness. Next, we're going to move on to your lymph nodes. We're going to begin with your pre-auricular, post-auricular, occipital, sternocleidomastoid, submandibular, submental. Go ahead and turn your head that way. Anterior deep cervical. Go ahead and turn the other way. Posterior deep cervical. Anterior deep cervical, posterior cervical, and supraclavicular. Any pain or tenderness with that?
No.
Good. Next, we're going to auscultate over top of your thyroid, your temporal artery, and over the eyes for any bruits. And we're going to be using the bell of the stethoscope. Excellent. No bruises are noted. Next, Abby, we're going to go ahead and I'm going to put my hands here. I want you to open, close, move side to side. Any pain or tenderness?
No.
Good. There's no crepitus noted. Next, Abby, we are going to move on to the eye assessment. So we're going to begin with the vision test. I'm going to stand about 6 feet back. I want you to cover your left eye. And I want you to read the smallest line possible.
LTFPH.
Excellent. Go ahead and cover your other eye.
LTFPH.
And with both eyes open.
LTFPH.
Good. And I meant to ask you before we started this, are you wearing corrective lenses?
Yes.
Okay. And then one thing that I would actually like to perform real quick that I didn't during the skin assessment is I wanted to note that she does have some lesions on her forearms here. She has one right here, it's nevi, and it's a mole. It is symmetrical in size and shape. The borders are regular. It is uniform in color throughout. The diameter is about 2 millimeters by 2 millimeters, and it is not raised, and it does not look to be infiltrating any other areas of the skin. Next, Abby, we're going to move on to the visual fields. I want you to go ahead and cover your right eye. I'm going to cover the opposite eye, and I want you to tell me how many fingers am I holding up?
2, 1, 2.
Okay, go ahead and cover your other eye.
4, 2, 3.
Excellent. Next, we're going to move on to inspection and palpation of your eyes. We're going to begin with your eyebrows. Excuse me, I'm so sorry. Your eyebrows are uniform. There is a even distribution of hair over across your eyebrows. We're going to next move to your orbital area. I'm just going to feel here. Tell me if there's any pain or tenderness.
No.
Any pain or tenderness?
No.
Next, I'm going to just look at your eyelids here and inspect them. Right now, I'm inspecting for any ptosis, fasciculations, tremors, flakiness, redness, or swelling, which there appears to be none. Next, I'm going to pull down on your eyelids here and inspect your sclera and conjunctiva. I don't see any discharge. The lacrimal gland appears to be well intact. There's no foreign body objects, and it's a fleshy pink color. Next, Abby, we're going to move on to the external eye. I'm going to use my pen light here, and I'm going to just look at your corneas. Corneas do appear to be clear. You do have presence of a corneal of an arcus present. Your color of your irises are a bluish green tint, and then I just want you. We're going to do direct and consensual light, so I just want you to look straight at me. Currently, your pupils are about a 4. With direct, it transitions to about a 3. And consensual, we go to about a 3 as well. Other side. Beautiful. I want you to look at the pen and follow it inwards without moving. Excellent. Pupils are equal, round, reactive to light, and accommodation. I don't notice any pupillary defects, and there's no nystagmus noted. We are going to do extraocular muscles as well, so we're going to do the 6 cardinal fields of gaze. So I just want you to look at my finger and follow it without moving your head. And this also tests for nystagmus, and there's none noted. And then I'm going to shine this this light at you, and we're going to be doing this to look at the corneal light reflex. Corneal light reflex is positive. It is on the same side on both eyes. Next, Abby, we're going to do an ophthalmoscope inspection. And we're going to be assessing the lens and looking for the red light reflex. So I'm just going to go ahead and put my hand here, and I'm going to look into the eye. Excellent. You see here, the lens is clear. There is a presence of a red light reflex. The blood vessels, the veins are larger than the arteries. I don't see any cotton wool spots or AV nicking. Do you need a break? Are you okay?
I'm good.
Okay. The macula is round, and the disc is round. I'm having a little bit of trouble visualizing the actual retina itself. Let me try to look a little bit here. Okay, there it is. The retina appears to be a pinkish orange tone. We're going to look at the other side here. The lens is clear. There is a presence of a red light reflex. The macula and optic disc are both oval. The depth of the anterior chamber appears to be about 3 to 4 millimeters in size. Go ahead and look directly at me. Thank you. If you need a second, you okay?
Mm-hmm.
All right, next we're gonna move on to hearing and testing of the ears. I'm just gonna turn this off so it doesn't go dead. All right, I'm gonna slide your hair behind your ears real quick. All right, so the top of the ear meets the outer canthus of the eye. They are, both ears are symmetrical. I'm gonna go ahead and palpate here, Abby. Let me know if you have any pain or tenderness. Good, there's no deformities or lesions noted. Next, we're going to look in the auditory canal with the otoscope. I'm going to gently pull up on the pinna here and look inside the ear. There is a good amount of cerumen present in the ear. I am able to see the tympanic membrane. It is a pearly gray. And then there is presence of hair in the ear, but there's no foreign body objects, redness or swelling noted. I'm going to come around here and look on the other side. There's also cerumen present in the ear. On this side, tympanic membrane is a pearly white color. There's no redness, swelling noted, and there's no foreign body objects noted in the ear. Thank you. Okay. Next, we're going to go ahead and assess your hearing. I'm going to turn this off for a moment. We're going to begin with the whisper test. I'm going to cover this ear, and I want you to tell me what I say.
Apple.
Good.
Pencil.
Excellent. Next, we're going to do the Weber test. I'm going to strike this tuning fork, and I want you to tell me what ear you hear it in.
Both.
Good. Next, we're going to perform the Rhine test. I'm going to strike this tuning fork. I'm going to place it over the back of the ear, and I want you to let me know when you no longer hear it.
I don't hear it anymore.
Do you hear it now?
Mm-hmm.
Good.
I don't hear it anymore. I hear it.
Okay. Auditory conduction is greater than bone conduction. Next, Abby, we're going to move on to your nose. So I'm going to take a look inside the nose, but prior to that, the external nose appears appropriate for your size and shape. It is midline on the face. You don't have one side that's larger than the other. I'm going to occlude one there, and I want you to inhale. Good, we have good nasal patency. I'm going to occlude the other side. And we have good nasal patency. Okay, go ahead and tilt your head back for me. Excellent. On this side of the nair, there's no redness, swelling, deviation, or foreign body objects noted. I do note a little bit of nasal discharge. On the other side of the nair, I am able to see the metal part of her nose ring. There is no swelling or redness noted, and there is a good amount of hair in the upper portion of the nose. Next, Abby, we are going to move on to your mouth and throat inspection. Where did my pen light go? I lost it. I'm gonna reach behind you, thank you. We're going to inspect your lips. The color, they're pink, they are moist and intact. There's no cracking, swelling, or chapping noted. Next, I'm gonna go ahead and have you stick out your tongue. Your tongue is pink, moist, and intact. There's no cracking noted. Go ahead and show me your teeth. No presence of dental caries or broken or missing teeth. Open up all the way for me. Good, teeth look intact. Buccal mucosa is pink, moist, and intact. No perforations, ulcerations noted. Stick out your tongue. Go ahead and say ah. Inspection of the soft and hard palate doesn't show any ulcerations, deformities, or perforations, and the uvula appeared to be midline. Can you stick out your tongue one more time and go ah? And her tonsils are present. There's no swelling or redness noted. Next, Abby, we're going to move on to the lung assessment, okay? I'm just gonna move my supplies out of the way here. So I'm just gonna gently place my hand across your chest here. Respiratory rate appears to be about 16. It is even and non-labored. Chest wall is symmetrical, and there's no use of accessory muscles, retractions, or nasal flaring noted. Her AP to lateral diameter is about 1 to 2. And then we are gonna go ahead and auscultate your lungs here, okay? We're gonna be using the diaphragm of the stethoscope. I'm gonna do the apex of your lungs. Go ahead and take a breath. Breathe normal. Deep breath. Breathe normal. Deep breath. And breathe normal. Deep breath. And breathe normal. Deep breath. Breathe normal. Deep breath. And breathe normal. Thank you. I'm gonna go ahead and have you lift up your arm a little bit. Take a deep breath. And breathe normal. Take a deep breath. And breathe normal. Deep breath. Breathe normal. Sorry. Deep breath. Breathe normal. Deep breath. Breathe normal. Sorry about that. Deep breath. And breathe normal. All right. I'm going to have you turn. I'm going to come from underneath here, and we're going to do the same thing. Deep breath. Breathe normal. Deep breath. Breathe normal. Deep breath. Breathe normal. Deep breath. Breathe normal. All right, there are no adventitious lung sounds noted. I did not hear any crackles, rails, wheezes, rhonchi, stridor, or friction rubs. Next, Abby, we're going to assess thoracic expansion. I'm going to stand behind you here. I'm going to try to let the camera see. I'm going to place my hands here. And I want you to take a deep breath and exhale. Good. Thoracic expansion is equally bilateral. Next, we are going to measure your diaphragmatic excursion. Just while I'm sitting back here, I'm going to palpate, or I'm sorry, percuss. And I want you to exhale all the way. And take a deep breath. I'm going to take a measurement here. Diaphragmatic excursion is about 4 centimeters, which is a normal finding. Next, Abby, we're going to assess for crepitus. That's kind of like a popcorn feeling, so if you want to just go ahead and turn back towards me, you're going to feel me touch you here. And we're also going to assess for tenderness and pain, anything. All right, no crepitus is noted. Next, we're going to assess tactile fremitus. I'm going to have you say either the expression 99 or blue balloon. Or have you turn towards the camera and begin.
99, 99, 99, 99,
Sorry.
99,
And can you list for me real quick?
99.
Excellent. Tactile fremitus is equally bilateral. And then one last thing that I'm going to assess here, Abby, is I'm going to assess your vocal resonance. I just want you to say hello.
Hello? Hello?
All right. Vocal resonance is equally bilateral. It is a normal finding. All right. Next, we're going to move on to the heart assessment, Abby. I'm just going to have you kind of sit towards me real quick, and we're going to assess your anatomical landmarks. Keep losing that pen light. I'm going to kind of stand to the side here, so I'm going to let you kind of turn towards them. And right now, I'm just assessing the precordium, Looking for any heaves, lifts, or thrills, or pulsations. I'm looking at the sternal borders and sternum, sternal notch, angle of Louis, which, as I said, I don't see anything. Next, I'm going to use the palm of my hand and palpate for any thrills. Oh, I'm sorry. I actually need to have you lay supine during this. My apologies. I'm going to come up from underneath here. Good. Good. We're going to move on to the apical impulse. And go ahead and turn over on your side for me. Good. There is presence of an apical impulse. Next, Abby, we're going to move on to auscultation. We're going to, you can go ahead and lay back for me. We're going to begin with the diaphragm, and we're going to listen to your 5 different heart sounds. Beginning with the aortic. Aortic is going to be second intercostal space, right of the sternal border. Then we're going to move to the pulmonic, which is going to be second intercostal space, left of the sternal border. We're going to move to Erb's point, which is going to be the in between the third and fourth intercostal space to the left of the sternal border. We're going to come up from underneath and listen to the tricuspid, which is around the fourth and fifth intercostal space to the left of the sternal border. And lastly, mitral, which is fifth intercostal space, mid-clavicular line. I am able to auscultate S1 and S2. There is no S3, S4, or splitting. Next, I'm gonna auscultate one last time, but I'm gonna have you hold your breath the whole time. We're gonna do aortic, pulmonic, Erb's point, tricuspid, and mitral. Excellent, go ahead and breathe. Next, we are going to use the bell of the stethoscope and listen for murmurs. We're going to do the 5 locations again. I'm just going to come up from underneath. Aortic, pulmonic, Erb's, tricuspid, and mitral. While assessing, I'm assessing for timing, duration, pitch, grading, intensity, pattern, quality, location, and radiation. But there are no murmurs present on this patient. And in the next video, we are going to move on to inspection of the abdomen. Thank you. Okay, Abby. Now we're going to move on to the abdominal assessment. I'm going to go ahead and have you lay down for me. And go ahead and lift up your shirt. And we're going to begin with inspection. So her abdomen is flat. It is non-distended. I don't see any abnormal surface motion. Next, Abby, what I'm going to do is I'm going to go ahead and have you try to lean forward right there. Thank you. I don't see any protrusions, hernias, or separation of the abdominal wall muscles, so you can go ahead and lay back now. Next, we're going to move on to auscultation of the abdomen. We're going to begin in the right lower quadrant. We're going to move to the right upper quadrant, left upper quadrant, and left lower quadrant. Abby has normal active bowel sounds. Next, Abby, we're going to move on to percussion of the abdomen. We're going to start back down here in this right lower quadrant. And tympany is heard throughout. I did not note any dullness over the liver or the spleen, which that can be a normal finding. Next, Abby, we're going to move on to light palpation, and I'm going to be palpating for muscle resistance, tenderness, or masses. Just going to do some light palpation here in a circular motion. Any pain or tenderness? Good. No masses or deformities noted. Next, we're going to move on to deep palpation, and we're going to begin over the umbilicus and then over the umbilical ring. Any pain or tenderness? We're We're gonna move down to the right lower quadrant. I'm gonna use deep palpation to palpate for the liver border. Go ahead and exhale all the way. And inhale. All right, I am unable to palpate the liver. Typically with the liver, you're gonna see about, the borders are gonna be about 8 centimeters, but like I said, I'm unable to palpate it. We're gonna do deep palpation over on the left upper quadrant and down into the left lower quadrant. And then next, Abby, I'm gonna kind of have you turn up on your side. I'm gonna palpate your, I'm gonna palpate for your spleen again. And I'm unable to palpate the spleen, which is a normal finding. And then next, lastly, because I forgot, I'm gonna palpate here for an aortic pulsation. And I do not feel any aortic pulsations noted. Next, Abby, I'm gonna go ahead and have you sit up for me. And I want you to turn away from the camera. And I'm gonna find your costal vertebral angle here. It's gonna be in between the spine and the last rib. And that's gonna be about where your kidneys sit. And I'm gonna do some indirect percussion here. If you have any pain, just let me know, okay?
Okay.
Any pain?
No.
All right, gonna move to the other side. Any pain? No. Excellent. So you can go ahead and lay back down now. Next, we're gonna move over onto your to your blood vessel assessment. We're gonna begin with palpating the pulses in your distal extremities, and we're gonna look for bilateral pulsations, amplitude, contour, and rhythm. So we're gonna go down to the pedal pulses. I'm gonna try to, so that you guys can see in the video. Pedal pulses are about a +2. They are rhythmic. We're gonna move down to the posterior tibial. Posterior tibial are about a +2. Excellent. We're gonna move up to the radial. Radial are +2 bilaterally. Rate and rhythm is normal. We're gonna go up to the brachial. We're going to assess the carotid, but we're only going to do one at a time. And that brachial was a +2 as well. This carotid is a +2. We're going to move to the other side here. And it is +2, normal rate, rhythm. And then next, Abby, we're going to auscultate the carotid arteries, the abdominal aorta, the renal, the common iliac, and the femoral arteries for bruits. I'm going to begin with the carotid. I'm going to place the stethoscope here. We're going to move down to the aortic. Over to the renal. To the common iliac. And then down to the femoral arteries. Alrighty. Next, using my pen light here. There it is. I'm just gonna look at your jugular vein and look for jugular vein pulsation. And there is no jugular vein distension, but I am able to see a slight pulsation. Next, Abby, what I'm going to have you do is I'm going to have you sit up a little bit, and we're going to expect to see that pulsation go away, which it has. You can go ahead and lay back down, and I just want you to turn your head all the way that way. I'm going to slide your hair out of the way. And there is no JVD noted. All right. And then, Abby, lastly, we're going to just inspect your peripheral veins and arteries. We're going to be looking at the color, your skin contour, which your skin is uniform in color throughout. You don't have any hair on your legs because do you shave your legs? So there's no hair, so I can't really look for hair distribution. Lower extremities are warm, dry, and cool throughout. I don't see any ulcerations or issues with venous return patterns. I'm going to look at the arms one last time. They're warm, dry throughout. She does have a presence of hair on her upper extremities. And then next, Abby, we are just going to, I already checked pulse quality, so we are going to defer that. And then is there any tenderness?
No.
And then we're just going to look for any pitting edema of the lower extremities, pain or tenderness?
No.
And there is no pitting edema of the lower extremities. So next, Abby, we're going to move on to the neurologic tests, and we're going to start with the cranial nerves. You can go ahead and sit back up. I'm going to have you close your eyes, and I want you to tell me what the scent is.
Peppermint.
Excellent. It is peppermint. We already assessed cranial nerve 2, 3, 4, and 6 during our visual acuity assessment and 6 cardinal fields of gaze. So we are going to go up to cranial nerve number 5. And what I'm going to have you do, Abby, is I want you just to go ahead and puff out your cheeks, lift up your eyebrows, and smile. Good. And that, I'm sorry, that actually tested cranial nerve number 7. Cranial nerve number 5, we're just going to be able to see if she can discern touch. So I want you to close your eyes and just tell me if you feel it.
Yes. 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 Yes.
Excellent. So with that, we're going to move on to cranial nerve number 8, which has already been done during the hearing assessment. That was with the Reen, the Weber, and the whisper test. Cranial nerve number 9 is going to be the glossopharyngeal. We can either elicit a gag reflex, or we can just look to have her say ah and see if the uvula raises with ah and is midline. So go ahead and open up and go ah. Uvula does raise and is midline. Next, Abby, we're going to move on to cranial nerve number 10. Cranial nerve number 10 is just used with phonation, so she is speaking clearly and concisely, so we know cranial nerve 10 is intact. Next, we're going to move on to cranial nerve 11. It's going to be the shoulder shrug. I want you to push up against my shoulders, or against my hands, thank you. And then number 12 is going to be the hypoglossal nerve. I just want you to stick out your tongue and turn it left and to the right. Excellent. So next, Abby, we're going to move on to the cerebellar and proprioception assessment. And I want you to do rapid coordination of like this. And you go as fast as you can. Excellent. Next, I want you to take your finger and touch it to your thumb, each side. Excellent. Next, we're going to evaluate your sense of balance. So I'm going to have you stand up. I want you to close your eyes. And I just want to see if you're able to maintain stance. Go ahead and lift your one leg up. And see if you can balance. Excellent. And do the other side. All right, so Romberg test is mostly positive. We do have a little issue with balance. Next, Abby, I'm going to observe your gait. So I'm going to stand over here. I want you to walk towards me. And we're looking at heel strike, stride. I want you to turn around and walk on your tippy toes. Excellent. And then I want you to walk in a line. And this also is evaluating her balance, and she is able to do so. All right, we can move back over to the assessment area. Next, Abby, we're going to test sensory function. We're going to test your primary sensory response to superficial touch and pain. I just want you to tell me if something is dull or sharp. Go ahead and close your eyes and just tell me.
Dull. Sharp. Dull. Dull. Sharp. Dull.
Excellent. Next, we are going to evaluate your position of sense and time. So I'm going to take your finger here. I just want you to tell me if I'm moving it up or down.
Down. Up. Right. Left.
Excellent. Next, we are going to move on to your ability to identify familiar objects by touches and manipulation. So keep your eye closed. Let me grab my items. Oh, sorry about that. And I want you to tell me what this is that I placed in your hand.
Coin.
Excellent. Thank you. And what is this?
A key.
Thank you. It is both a coin and a key. Next, we're going to do the 2-point discrimination test. I want you to keep your eyes closed. I want you to tell me if you feel 1 poke or 2.
1. 2, 1, 2, 1.
Excellent. Next, Abby, I want you to tell me what number I draw in your hand.
2, 4,
Excellent. And then I want you to tell me which part of your body I'm touching with your eyes closed.
my left arm, my right leg, my left shoulder, my right shoulder.
Excellent. So next we're going to move on to your reflexes. I'm going to have you lay down one more time. And we're going to assess your abdominal reflex. I'm going to grab my hammer here. Abdominal reflex is present. I'm going to have you go ahead and hang your foot off for me real quick. And we're going to check the plantar reflex, also known as the Babinski. Excellent, thank you. All right, so you can go ahead and sit back up now. Next, we're going to move on to the deep tendon reflexes, and we're going to check the bicep. So what I'm going to have you do is I want you to flex your arm real quick and come back. All right, you're going to feel me tap here. Good. Find that tendon. Excellent. Reflexes are intact. Next, now we're going to do the brachioradialis. So we're going to find the radial artery. And we're going to go about 2 inches above it. Good. I'm going to slide your watch down. Good. Next, we are going to do the triceps. So I'm going to take your arm. Just kind of want you to keep it nice and relaxed. Good. And we're going to do the other side. I'm just going to support it here. Excellent. And then we're going to finish off with the patellar. I'm going to stand off to the side while we do it. You don't want to be kicked. Good. Excellent. And then we're going to do the Achilles. So I'm going to kind of push up on your foot here, and when I tap, I'm going to feel you push down on my hand. Good. Good. So all deep tendon reflexes are intact. Next, Abby, we're going to assess for ankle clonus. I'm just going to kind of have you move your foot around here. Good. Excellent. Note ankle clonus noted. And then next we're going to go down to the musculoskeletal system. So with this test, Abby, I'm just going to be looking at your joints, your muscles, and we're going to begin with inspection. So right now we're just looking at sides for alignment. Your shoulders are in alignment, your hips are in alignment, the way your hands are placed are within alignment. And I don't see any deformities, and everything looks to be symmetrical. So next we're going to move to the skin and subcutaneous tissues. And I'm just going to palpate here. We're going to palpate over your joints and muscles. Your color is normal for ethnicity. Skin folds, there are no extra skin folds noted at the creases of the arms. There's no swelling or masses noted. Any pain or tenderness?
No.
All right, your muscles appear to be the same size. They're symmetrical. I don't note any fasciculations or spasms. Next, we're going to assess for crepitus, which I don't feel any crepitus, and there's no tenderness, she said, and no swelling. Next, we're going to test your joints for range of motion. So we're going to begin with your hands and wrists. I want you to move your hands up, down, and I want you to adduct and abduct. Excellent. Next, we're going to do your wrists. I want you to go towards the ceiling, towards the floor, adduct and abduct. Excellent. Go ahead and put your arms out. I want you to take them up as high as you can. Reach across. Excellent. Reach the other arm across. Excellent. Bring your right arm across. Good. And your left arm across. Oh, sorry.
Sorry.
And your left arm across. And then I want you to do windmills. Excellent. Next, we're going to move on to your temporal mandibular joint. Just go ahead and open. Move your jaw side to side. Any pain or tenderness?
No.
Good. All right, next we're gonna do C-spine. So we're just gonna do range of motion. Any pain or tenderness?
No.
Good, we have good range of motion. I'm gonna have you stand, and we're looking at her spine here. We're looking for a normal S spine curvature, which it is a normal S spine curvature. I don't see any scoliosis or abnormal curvature. I'm gonna palpate down your back here. Pain or tenderness?
No.
And I'm gonna palpate each part of your spine here. Pain or tenderness?
No.
Excellent. Go ahead and I want you to bend over and touch your toes. Good. I want you to go ahead and hyperextend back. Good. I want you to twist like you're looking behind you. And the other side. Excellent. You have good range of motion of your spine. Next, I'm going to go ahead and have you lay down. And we're going to do your hips. I want you to lift your leg up in the air and bring it down. Left leg up in the air. Bring it down. Bring your knee to your chest. Good. Bring your other knee to your chest. Excellent. I want you to, I'm going to abduct your leg. We're going to check rotation, pain or tenderness. Good. We're going to abduct your leg, pain or tenderness. Good. And I'm going to bring your leg across you for adduction. Good. And then on this leg, adduction. Good. Can you go ahead and flip over for me real quick? I want you to take your leg and I want you to bring it back. Any pain or tenderness?
No.
Good. And bring your leg back. Any pain or tenderness?
No.
Good. Okay, you can go ahead and sit back up. Next, we're going to move down to the feet and ankles. I want you to use your feet. I want you to bring your feet towards the ceiling. Push them towards the floor. Inwards and abduction. Excellent. Go ahead and just rotate for me. Good. Next, we're going to move on to muscle strength. Go ahead and put your hands out. Push me down. Pull me towards you. Excellent. Put your arms up like this. Push me away. Pull me towards you. Oh, okay. Go ahead and lift your arms to the side. Don't let me push down. Excellent. Push down on me. Excellent. Go ahead and I'm going to push against you. Resist. Good. Push against me and resist. Excellent. Using your legs, push me away. Or I'm sorry, pull me towards you with your legs. Push me away. Excellent. With your feet, push on the gas. Good. Lift off the brake. Excellent. Muscle strength is equally bilateral throughout. There is no left or right-sided weakness. And then to finish, Abby, we're going to inspect your feet and ankles just with weight bearing and non-weight bearing, which we did. And during that inspection, I was looking at your contour alignment with your tibias, which you do have good tibial alignment. And then to finish, the patient does have 5 fingers on each hand and 5 toes on each foot. That today, Abby, concludes our head to toe assessment. I appreciate your time.
Yeah, thank you.